I've always been interested in hormones, but I'm especially interested in hormones now because I am turning 50 this year. And there's a lot of misinformation out there about hormones. So I want to clear up a few things today. First of all, menopause is just one day in time. Okay. It is one day when you've gone a full year without having a period. Then that one day is menopause. After that day, you are postmenopausal. And before that day, you're premenopausal from the time you started your period until you have that full 1 year without period. That's called premenopause. Now, it gets a little sticky, right? If you had a hysterectomy, you could go through an abrupt surgical menopause. And if you've had an ablation, it's kind of hard to know, right? But those are the general terms. Now, what sounds very much like premenopause, but is a little bit different, is perimenopause. And perimenopause is around the time of menopause. And this is a really difficult time for a lot of women. The reason it's difficult is because the hormones are all over the place. And this can start in our 30s and go on into our 40s and sometimes even into our early 50s. And this time of our life can feel really awful. Symptoms of perimenopause are wide ranging, but some of the common ones are depression, anxiety, brain fog, weight gain, hot flashes, night sweats, um, vaginal dryness, irritability, like severe PMS. This can be perimenopause. And it's really hard to treat the hormones during perimenopause because they are all over the place. If you test them one day, it's going to be different what they are the next day, and another day, it's going to be even different. But there is a lot you can do in perimenopause. Perimenopause is the time I like to get all my ducks in a row, so to speak. Let's optimize the adrenals. Let's optimize the gut. Let's get the healthy cells healthy at a cellular level. And then when we're in menopause, let's talk hormones. So, we've been told some conflicting information about hormones. Are they bad for you or are they good for you? But here is the long and short of it all. Synthetic hormones prescribed in a one size fits all manner without testing, like we used to do, Premarin and Prempro, are not good for you. They are synthetic. They are not the same as what your body makes, and they do not convey the same beneficial effects that natural hormones do. There are lots of risks with synthetic hormones, and I would never prescribe those. Okay. What is good for you is natural, low dose, bioidentical hormones customized to you. So I believe in testing hormones via the saliva because that is the way to get the most accurate result, and then customizing low dose natural hormones specific to what the patient needs. No two patients need the exact same prescription. This is truly customized care. And with it, when this is done properly, not only do people feel great, but they're protecting themselves from heart disease, um, Alzheimer's disease, osteoporosis. And if done correctly, there is no increased risk of cancer. Now, hormones are important for men too. Women are going through menopause around the same time, and sometimes even a little bit earlier. Men are going through andropause, and that's the lowering of testosterone. And there's a lot that can be done, and there's some health benefits for replacing men's testosterone when needed as well. Healthy hormones equal a healthy you. So I hope this was helpful. Have a great day.